What is cough? Cough reflex, by definition, it is a body protective mechanism to eliminate irritant materials from airways, and we can describe it as a horrible, forceful release of air from lungs of a speed of 100 miles per hour. You can think of it just like explosion. Types of cough. There are many types of cough, but the most two important types are productive cough and the dry cough. Productive cough is a cough that comes from the chest, is often triggered by excessive mucus, as in case of bronchitis. Dry cough is so called because it doesn't produce phlegm. It can result from a wide variety of problems, from mild environmental irritants such as smoke to disorder or infection diseases such as asthma, the flu, or atypical pneumonia. Third type is a bronchitis cough. This type of cough produces yellow-gray phlegm and is normally accompanied by cold-like symptoms such as a stuffy nose, headache, and fatigue. Fourth type is a post-viral cough. It is a common symptom following an upper respiratory tract infection due to throat inflammation. Last but not least is a whooping cough. It's a sharp gasp of a breath at the end of long coughing, as in case of bacterial infection called pertussis. Well, how cough response happen? Several events need to take place in sequence. We can summarize them in three phases: inspiratory phase, compression phase, and expiratory phase. In the first inspiratory phase of the cough reflex, inspiration of a large volume of air occurs, accompanied by stretching of expiratory muscle and increased pressure inside the lungs. In the second compression phase, closure of the epiglottis occurs, larynx contract, and vocal cords become tense to entrap air inside the lungs. Contraction of muscle of the chest wall, diaphragm, and abdominal wall, which result in increase in intrathoracic pressure. In the last expiratory phase, the epiglottis opens, resulting in high expiratory airflow under the high pressure and producing the cough sound. Large airways compression occurs. The high flow dislodge mucus from airways and allow removal from tracheobronchial tree. So when does the cough reflex become abnormal? The reflex is impaired in the person whose abdominal and respiratory muscles are weak. This problem can be caused by disease conditions that lead to muscle weakness or paralysis. Also, in bed rest interferes with the expansion of the chest and limits the amount of air that can be taken into the lungs in the preparation of coughing, making the cough weak and ineffective. Damage to the internal branch of the superior laryngeal nerve, which relies in the afferent branch of the reflex arc. Now, let's get to the most important part. There are some techniques that aid in removing secretions and irritant materials from the airways. The first technique or method used to enhance the cough reflex is called deep coughing. It is very simple. You start by taking a deep breath, then hold that breath for 2 to 3 seconds. After that, you use your stomach or abdominal muscle to forcefully expel the air. This deep cough technique is less tiring and more effective in cleaning mucus out of the lungs. The second technique is called half coughing. Half coughing or huffing is alternative to deep coughing if you have trouble in cleaning your mucus. The difference between half and deep coughing is that the epiglottis remain open during inspiration and expiration. It is done by take a breath that is slightly deeper than normal. Then use your abdominal muscle to make a series of 3 rapid exhalations with the airway open, making ha 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 sound. Follow this by controlled diaphragmatic breathing and deep coughing if you feel still mucus is moving. Thank you very much.